Hi Professor, my name is Samreen Kaur and I'm going to discuss about what anti-anginal agents are. Let's start with course content, what it includes. It's like introduction, classification of angina, drug classification, role of nurse. Also, I'm going to compare and contrast the relationship for different population and different disease condition. Lastly, I have mentioned references from where I have taken the content which I'm discussing further. Um, so let's start with anti-anginal agents. So it's help to treat angina pectoris. It's a specific kind of pain that starts in the chest. Why? Because the heart blood supply is insufficient. So the requirement is more, but the supply is less. In that condition, we need anti-anginal agents to treat a person. Next, I'm going to try discuss about what angina is basically. So it's like when oxygen demand is more than the supply. So in that case, anti-anginal drugs aim to dilate the coronary vessel to increase flow to the heart and decrease heart workload by reducing demand. So typically it happens when the heart rate is decreased or contractility happen. Next, I'm going to discuss about different type of angina. Basically, there are four different type of angina, which is stable, unstable, variant, and microvascular. So, what is stable angina? Stable angina is something we don't have to worry much about. It just go away in 5-10 minutes. It happen because you do exercise, yoga, or cycling. So it's increase the heart rate basically, because when the heart is working more than normal, in that condition stable angina happens. But what is unstable angina? It is different than the stable one. It has no set rhythm. Basically it happens when a person is at rest. So main cause of this can be arteriosclerosis, which leads to blockage and prevent the blood to reach heart. Now I'm going to discuss about third type of angina, which is variant. It occurs when the muscle of heart artery suddenly tightens and leads to constriction. The coronary artery might spasm, shutting off the heart supply of blood, and this leads to discomfort in a person. Lastly, I'm going to discuss about what microvascular angina is. It's a symptom of muscular microvascular disease. It's a form of coronary heart disease that affect all the small, not all, some of the small arteries that are in heart. So it leads to microvascular angina. Now let's talk about classification of anti-anginal drugs. So basically there are three type of drugs that can be given: organic nitrates, beta blockers, and calcium channel blocker. They have their further examples and or classifications. Like in organic nitrates, it's glycerol or isobide. Beta blockers are like propranolol, atenolol, metoprolol. Calcium channel blocker like verapamil and diltiazem. Next is what are the indication for anti-anginal drugs. So it helped to reduce or relieve angina which happen due to coronary artery disease during the time of acute attack or prophylactically. It can also be given in case of severe respiratory distress a person is going through, in case of decreased myocardial conduction. Not only this, but it can be used to treat angina and syncope as well. Angina patients who have hypertension as well, so these drug classification can be used in such case to treat hypertension and angina both at the same time. Sublingual nitroglycerin is most effective in recurrent variant angina. Continuous infusion and transdermal patches are used for unstable kind of angina. So if where we have to continuously give, we use mostly it's transdermal patches are used. Comparing and contrasting drug classes and different diseases and populations. So it has two slides that I use to describe the difference. In first slide I will talk about disease condition and the second slide the population. So it can be given in coronary artery disease. Why? So it can increase the blood flow to the heart muscle. Also it can reduce the workload of the heart and relieve chest pain. In case of hypertension, manage hypertension by reducing blood pressure and heart rate. Also, lower risk of angina episodes in hypertensive patients. Next is heart failure. Some kind of anti-anginal drugs like beta blockers. It can be used. Why? To improve heart function. Also to reduce the compliance like such as heart attack conditions. Next, I'm going to discuss about population. So if I talk about different kind of population like elder, so we can't give every medication to elder because they we mostly choose the less adverse drugs like calcium channel blockers, verapamil. These medication will help to reduce hypertension as well, which is commonly seen in elder population. Pregnant women, due to possible hazard to the ongoing baby or to the fetus, we have to be extra caution in case of pregnant women. In case if we or a doctor prescribe a medication, continuous monitoring for side effect or drug efficiency can is need to be seen. So nitroglycerin can be used, but it also need observation because that's very crucial. Now, patient with comorbid conditions. The selection of anti-anginal medications may be influenced by the disease condition like diabetes and hypertension. The patients who have both angina and hypertension may be relieved by beta blockers. Role of nurse in case of anti-anginal agents, that is assessment, monitoring and administration of medication, nursing implementations. In case of assessment, we have to assess the pain, that with the help of medication the pain has been relieved or not. Neurological status, for knowing that the person or the patient is aware about their environment, time and their surrounding. Vital sign monitoring is very much important because it helps to know about their vitals or their requirement and treatment, ongoing treatment. Next is accurate administration of medicine is a role of nurse to accurately administer it to the right patient, right drug, right route, right time. We have to monitor for any side effect to prevent patient from any further life-threatening condition. Monitoring the drug effectiveness so that we can know that the drug is helpful for the client. Next is nursing implementation. We have to educate our patient and the caregiver about the food they are required to eat, right? And the food they need to avoid, the health education, accurate documentation about if, for example, a person is allergic to some kind of medication, we have to accurately document everything. Comfortable measure, not only providing medication is a role of nurse, but also comfortable measure like changing position, providing pillow, diversional therapies are important, or sitting with them and providing them some psychological therapies, listening to them carefully, and consoling them in case they need. Rotation of injection site is very much important so that it can prevent any kind of like if a person is having blisters or they pain on the side of injection site, so we can rotate it or they can easily manage that. Patient comfort is must. We have to be very familiar with our client. We have to know about what they want and what not. We have to make them comfortable because they're already going through a condition called angina, so we have to be a little more cautious with them. Lastly, it's about references from where I have taken my content. Thank you so much, Professor. I hope you like that. Thank you.